Welcome to our HILL 2022 Healthcare Forum, a program from the Greater Macon Chamber of Commerce. We're delighted that you are joining us here at the Douglas Theater. What a rich venue, over 100 years. Today, the Greater Macon Chamber of Commerce is pleased to present a moderated, frank, and intimate conversation with healthcare leaders from all over Central Georgia. Thank you all for being here. HILL 2022, a special series on healthcare, education, advocacy, and leadership, is generously supported by our presenting sponsor, Atrium Health Navicent, our hospitality sponsor, Central Georgia Cancer Care, our platinum sponsor, Houston Clinic, our gold sponsor, Internal Medicine Associates, our entertainment sponsor, Skin Care Physicians of Georgia, and at this time, I'd ask that you please welcome Luis Fonseca from Atrium Health Navicent to the podium for a few remarks. Come on, Luis. Atrium.
Thank you, Dr. Allen, and thank you all for joining us this afternoon. It is certainly my pleasure to be here representing Atrium Health Navicent, just down the street. My first time in this beautiful venue. I didn't even know where it was. I've driven by it many times, never been here. But again, thank you also to the Greater Macon Chamber of Commerce for really supporting and hosting this conversation about healthcare. As Dr. Allen mentioned, I'm Luis Fonseca. I have the privilege to serve as the president of hospitals and clinics for our market here in Georgia, Central and South Georgia. I wanted to just take a few minutes to speak about the fact that we're going through a lot of changes. Healthcare has been a very focused area and something that we continue to look at. And the last 2 years have only placed a greater spotlight on that. And so it is our hope that through the conversation today with my colleagues up on stage, we'll be able to address some of the key elements of what's happening in our industry, how we see it shifting, and how we see it moving into the future. So with that, I hope you guys enjoy the conversation, get some great material and content out of that, and hopefully we'll see you all at the reception afterwards. Thank you all so much.
Thank you again to our friends at Atrium for all of your support, and for all of our sponsors, thank you for your support. At this time, it is my honor to introduce our moderator today. I have a written selection here that I'm supposed to say, but I'm going to veer from it just a little bit to say Julia Magda will be moderating today, and she is a woman of great intelligence and an even greater sense of service to the community. She has done a fantastic job in the meetings I've been in with her over the years. She is what's right about Macon Bibb, and I want to thank you personally for all the service you've given to so many organizations throughout Middle Georgia. You are selfless in your commitment to others, and for that we all appreciate you. So let's give her a hand before she comes. I mentioned that intelligence part. Here's a person with a BBA, a JD, and magna cum laude graduate. We ought to be proud just to be in her midst. Give her another hand as she comes.
Thank you so much, Dr. Allen. I wear the esteemed title of past chair of the Chamber of Commerce. So it's nice to come back and be with all of you. I'm going to grab my program because I wanted to point out that our bios of our panelists, our very esteemed panelists, are included here. So I'm not going to read that for you, but I do want to invite you to take the time to look at it at your leisure. I do want to introduce them, though, as we go from the table from left to right. We have Stephen J. Daugherty, who is the CEO and President of Piedmont Healthcare here in Macon. Did I get your title correct? I know you have 2 hospitals under your belt.
You got it.
Okay. Luis Fonseca is the President of Hospitals and Clinics for Atrium Health Navicent, whom you just met. You'll wave your hand. Shannon Gordon is the CEO of River Edge Behavioral Health. And how many counties do you serve?
8.
8 counties, okay. And Renee Haynes, MD, Dr. Haynes, is the District Health Director for the North Central Health District, our public health partner. And how many counties do you serve?
13.
Very good. All right, well, we're going to get started. Our first question, and we're going to just take this left to right, and I'm going to mix it up for y'all later. First question, though. Health is more than health care. What does that statement mean to you, and how, if at all, does it inform your organization's mission? Health is more than health care. All right, Stephen?
I'd say, healthcare is kind of the end of the line. If you go back and look at how people get to us, there are a lot of social determinants, poverty, food and housing insecurity, racism, education, economic opportunities. So when you look at those social determinants, this community in particular has a lot of challenges. We've got double the poverty rate of the rest of the nation, and that makes all of our jobs here maybe a little bit harder. So as we think of health, you have to take all those things into consideration, and hopefully our physicians are looking at those social determinants as they evaluate those patients so that while they're in their care, they can address some of those as well, along with some partners in the community.
Thank you. Next.
Again, in addition to what Stephen said, really it's about, health is about the well-being of the mind, body, and soul. And healthcare is a vehicle by which we use to go ahead and care for every one of those at their point in need. And so, as an organization, we take a great deal of pride in that type of support. Our mission, which is to improve health, elevate hope, and advance healing for all. And so the key words, I think, in that statement is for all. And so as we're looking at healthcare, as we're looking at delivery, as we're looking at caring for those different components, there's three key elements that I think we traditionally like to focus on. And I will say that from our perspective at Atrium Health Navicent, we want to make sure that we're driving those three key areas, and they are improving access, quality, and outcomes. We are also looking at eliminating disparities. As Stephen mentioned, we have many of those. Equity and disparities are an important aspect of what we do. And lastly, we want to make sure that we're really placing a very deliberate and focused effort towards addressing diversity and inclusion. And those are the three things that we look at as an organization, and I think that if we can continue to improve in all those areas, I think we'll make our communities that much better.
Thank you. Dr. Gordon?
To add on to what these esteemed gentlemen have said, healthcare is service delivery to promote or restore a state of health and well-being. However, there are many individual, familial, and societal factors that contribute to either health or disease. Accordingly, in addition to working to deliver superior specialty health care for the brain-based health conditions that River Edge treats, we work to promote health and well-being through attention to individual, familial, and social factors.
Go ahead.
All right, so I'm going to do two definitions. The first one I'm going to start with is the World Health Organization. I think their definition is closest to what aligns with North Central Health District. And so WHO says health is a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. And I think a lot of times we get caught up in that bottom part, which is trying to address disease. And I think that was adequately addressed by the other panelists, where they said healthcare tends to be the end of the spectrum, where you've noticed something is wrong and now you're trying to kind of do secondary prevention or lower prevention, which is tertiary prevention. And so how does it inform my organization's mission? I'm just going to read one other thing, because we actually carry our mission with us wherever you see a North Central Health District employee. It's on the back of our badges. And so the NCHD is dedicated to preventing disease, promoting health, and protecting Central Georgia communities against health threats through education, service, advocacy, and collaboration. And so we pretty much have a very wide responsibility. So we do the whole spectrum. So the same that was mentioned, although we do refer to River's Edge for behavioral health, but we inspect restaurants because nutrition is part of health. Being able to go out and have a healthy meal and not worry about contamination or whether or not the food that you're eating is going to make you sick later. We also do nutrition with women, infants, and children. So we do the whole spectrum. So health really is making sure that when someone gets up, they have that chance to be the healthiest them possible in their community, and then they have the personal responsibility like eating right, exercising, things of that nature.
I'm going to start with Luis with this next question, and it's a snowball, as they say in law school. It's lots of sticky questions altogether. But what is different about Central Georgia that either makes it easier or harder to address health inequities? What does your organization's scale bring to that tackling of that important issue of health equity?
Well, again, one of the things that we focus on when we're talking about healthcare, we always say, and you hear the term, that healthcare is local. And in this particular case, I would say that, in my opinion, it's hyper-local when it comes to the individuals, the community, and those that are in need of care and suffering from some of those different determinants of health. And so as we look at that as an organization, we consider ourselves to be an anchor institution of this entire community. We are, in many cases, one of the larger employers of the entire region. So again, we have a large footprint. We're a large economic driver of the entire region. And when you're looking at communities, one of the factors that many companies consider and think about when they're looking at considering a location for a new office, a new location, they look at those economic drivers. They look at what is the healthcare community, what is the school system, what is the business community, and those are all the factors that they're looking at. And so when we're looking at health and looking at supporting those inequities and those disparities, we want to make sure that we're addressing and honing in and focusing on those key social determinants of health, focusing on the fact that here in Georgia, and especially in this market and in this region, we have a very large disparity in socioeconomic, status. There's, many people that have been very fortunate and have been able to succeed and thrive. There's many others that have struggled and continue to struggle. And so therefore we make it a purpose, and I go back to our mission, I go back to what we had shared, where for all. Our mission is for all, and we want to make sure that we're really reaching out and communicating, connecting, and supporting those individuals in the community that are suffering from those various barriers, either housing insecurity, food insecurity, job insecurity. All those different components are the things that we're looking at. And so how do we put mechanisms in place and leverage our scale, leverage our size, leverage our entity to be able to address and impact every single one of those? For example, we have several programs looking at chronic disease management. We're looking at how we support some of our patients by dedicating resources to do direct outreach, to communicate with them, to provide them support, to provide them answers to their questions, to give them guidance and direction on how they can ensure that they're staying compliant with their regimen. We're looking at supporting, medication adherence. Many times there's this choice of, well, do I go fill my prescription or do I fill my tank with gas? Those are the things and the realities that we're having to deal with and how we navigate and support that population. Focusing on food insecurity, for example, we're looking at we've created a food pantry. Per se, where we call it our Food as Medicine program, and we call it our food pharmacy with an F. And again, the focus there is to ensure that we have a mechanism by which we can provide clear alternatives to our patients, teaching them that with these products and with these goods, you can make healthy meals that will further contribute to your activities of daily living and improving your overall health. So those are just some of the factors that we're looking at, and we leverage our scale in a way that supports those activities where we can reinvest in the community, supporting their health in a very specific and focused way that will hopefully prevent any type of decline or them having to present to the facility for a higher level of care. So that's, I think, some examples of what we do and how we address that.
Okay, thank you. Shannon?
To address what makes it easier, I think venues like this and conversations like this move things forward. Some of the challenges that we face, however, are we operate in a health professional shortage area, especially primary care, and in our world, psychiatry. And what we know is that when people have a primary care health home, their overall health status improves because activities can be preventive rather than reactive. And then the challenges of our rates of poverty, our rates of lack of insurance, and our disability per capita are other challenges that we have. River Edge also operates kind of in a soup that's pretty amazing. Georgia ranks 10th in population in the country. However, Georgia ranks 41st in funding for mental health services. Y'all, that's not a gap, that's a chasm. Okay? And so what that means is access to care is challenged, particularly with the rates of uninsurance that we have. However, River Edge has been really aggressive in trying to address that. Though the area that we're charged to serve is only about 300,000 of Georgia's roughly 10 million residents, River Edge ranks second in overall revenue for community mental health centers in Georgia. How has that happened? It's happened because we are aggressive and entrepreneurial about saying our residents need this. How can we find or create the resources to meet that need? Pardon me. The realities are that 1 in 4 people will experience a mental health challenge at some point in their lives. If a person chooses to drink or use, 1 in 7 will develop some form of substance use disorder. And 1 in 6 babies is born with some form of developmental disability. Those are the brain-based conditions that we treat. Knowing those realities, we have been very purposeful about bringing education about those facts, so in order to decrease the stigma that has commonly been associated with those conditions. These are brain-based health conditions just like epilepsy or other issues that are more have been in the past more socially acceptable. And I want to bring some good news too. Treatment is effective and recovery can be expected. Not just symptom reduction, but building a life worth living. And what we know for people with developmental disabilities, with appropriate supports, people can live meaningful and contributing lives in the community. So those are some of the things that we're doing to achieve scale, number one, in a really challenged environment, and then to use our size to try to bring difference to the community.
Thank you. Renee?
So I'll do a glass half empty and a glass half full. I don't want to be completely negative. We could have a party doing the negative. So the first one I'll do is in terms of what makes it more difficult. So in Georgia, there's kind of 2 Georgias, and there's actually grants for that because folks have realized you have a really concentrated center of resources in Atlanta, and then you kind of have the rest of Georgia working to serve the residents that live outside of the metro Atlanta area. So the reason why I bring that up is because a lot of healthcare is dependent on the staff members. One of the reasons we're meeting today is because we're welcoming a new class of medical students. And so what happens with medical staff is that they're considering where they want to live because they have families a lot of the time. So they care about a lot of the things that were mentioned by the other panelists, like what does the school system look like? How's it going to be if I live here in terms of will my spouse be able to get a job, things of that nature. So I will say in terms of making it more difficult is that a lot of the times those providers are drawn to Atlanta, the bright shimmering lights there. So that does make it more difficult. What I will say is that I think Central Georgia has a lot of charm and possibility. And so I will say, folks ask me, I came down here from Atlanta, I worked at the Atlanta VA, and folks ask me all the time, are you going back to Atlanta? And I say, no way, I love Macon. I don't have to fight with traffic. I love my neighbors. They have lots of beautiful parks. Amerson is gorgeous. So I think one of the things that makes it easier is that even though Central Georgia has a smaller population, it's easier to make those connections with patients and clients, because a lot of the times that provider is also a member of a similar community that the patient or client is coming from. So I'll do that from my glass half empty, half full. In terms of the scale, we serve 13 counties, and I'm glad that I said 13 counties because I don't want River's Edge to think we're trying to bite in their pie. I just think there's so much mental health disparity that you need all hands on deck. So we recently started doing telemental health, which is we're trying to get, if it's a very long wait or if they're one of the counties that River's Edge does not touch, that they're able to get telemental health services. And that's being launched from our lead county, which is in Houston County. What I will say in terms of the micro level, individual families and neighborhoods is, as much as we can, we do try to go out to those communities. We had a program for folks who were homebound, who wanted to get COVID vaccinations but could not make it to the health departments. We went to them. And so a lot of times, when possible, we try to go out into the community and meet people where they are. A lot of times you can, spread the word about who you are, and occasionally they'll bring someone to you if you get a chance to give them good service. And then I think here, as opposed to the macro level, I think that's the best we can do, is to just let folks know that we're here, we care about them. Oh, I have one other thing, sorry, and then I'll let go. The other challenge, and I'd like to see us have greater access to it, is internet. A lot of times broadband companies will do the numbers and it won't make sense for them to go into our more rural parts of central Georgia, which for us, that's a really big hindrance for healthcare, because if you're trying to do tele-primary care or tele-mental health, a lot of times you need that internet connection to get to that rural community. And so that breaks my heart a little bit, and I'll leave it there.
Thank you. Steve?
Well, I'm not sure I have anything new to add, but I will say, to me, the number one issue that makes it difficult here is just the crushing level of poverty. And it's not new poverty. It wasn't created with COVID or inflation. This is generational poverty. And we could probably spend the rest of the time talking about that. But where we're fortunate is we have a lot of great partners in this community. While we haven't hit the top of the hill yet, I think about the Department of Public Health, where Piedmont-Macon Hospital partnered with them so our residents could see clients at Daybreak, the homeless shelter. Because guess what? We share some of the same clients. They come to our ER, they come to Daybreak. If we can keep their medicines monitored and get them therapy, then they're not in the emergency department at the highest cost health care really that you can get. We have Mercer University. Our partnership with them to have their third and fourth year medical students in our hospital, because their medical school is about Georgia residents staying in Georgia to practice medicine, and we have a shortage of physicians not only in Middle Georgia, but throughout the state. So another great partner. The United Way, who's helping to tackle generational poverty. And so for those of you out there, if there's one organization you want to donate to that has a wide-reaching impact on this community, I would say the United Way. I don't want to forget our mayor with the Brookdale Resource Center. I think when we heard about that as a warming center, that was a great kind of one-shot thing, but it's evolved now to a resource center. And you may be surprised to know that it is not full of single males with drug addiction and alcohol. There are families at the Brookdale Resource Center. So finding them secure homes and the work we're doing with them. So there's a lot of great partners in Middle Georgia to help us overcome some of the difficulty we have. We have a long way to go, and I'm proud to sit with these other partners, Atrium and River's Edge and the Department of Public Health. I think together, while in some instances we compete, all of our interests are in having a healthier community.
Thank you. You brought up cost, so I'm going to start with Shannon on this question, but talk about the cost drivers for acute care, emergency care versus chronic care. And I think everybody on the stage treats both of those sides, chronic and acute. And what does that look like for payers in the future, the next 3 to 5 years? What is really driving up the cost of health care?
One of the things that I don't think people generally realize is that the costs of the uninsured drive up the costs for the insured. And the costs of of care for the uninsured drive up the cost of care. Delayed primary care and delayed health maintenance care drives up the cost for acute, emergency, and chronic care. Wage rates for frontline healthcare workers are rising dramatically, as are other wages in our post-COVID environment. And so those are some of the drivers that are coming. The reality also is that we operate in somewhat of a fragmented system, particularly in the mental health arena, and that fragmentation adds costs. And just to give an example, a vertically integrated healthcare pilot here in Central Georgia has demonstrated that access to needed outpatient, primary and specialty care saved $1 million in uncompensated care costs per 1,000 enrollees for partners. And other studies document that for every dollar invested in appropriate treatment and supports for behavioral health conditions, saves $7 in social costs, and when the medical cost offsets are added in, it saves $12. So the issue is, where do we invest our resources, and how can we invest resources to more effectively address front end versus deep end, because the deep end is more expensive.
Thank you, Brene.
So I'm glad you mentioned the fragmentation of the healthcare system, because I had put down silos, so that's a perfect segue. And just to give an example of that, it touches on so many aspects. For example, just medications. Because if you can't access a patient record, for example, if they went to the hospital or they went somewhere else, you could possibly give them a medication that interacts negatively because the patient doesn't recall. So I will say that that is one thing Georgia does try to do, where as a patient you can sign for the local facilities to share records, but fragmentation does play a part in that cost. From an economic standpoint, inflation, as the cost of things go up, the cost of service goes up, and we are in kind of an inflation bubble. I don't know when it's going to pop, but inflation is kind of skyrocketing. What you're paying just for groceries this year is at least easily, 10%, 15% more than you were paying for the same item last year. And so as healthcare providers, we're not immune to inflation. So if inflation is occurring in the country, it's also there and present in our institutions. And I'm going to do one last point. I think that what bites us a lot of times is prevention is not sexy. Mm-hmm. When you're trying to talk to people about how much money you've saved them by doing prevention, it doesn't have the same glamour as, maybe doing a triple bypass or doing something else. We're not about to be on, drama series doing prevention. It doesn't draw the crowd, but prevention really is where most of the cost savings can occur. If you can get primary prevention to be something that is enacted in your community is going to save significantly on healthcare costs.
Well, absolutely. I think if you look at acute care, the biggest cost driver for us is the technology to care for the patients that come to see us. I think politicians a lot of times want us to chase the red herring of pharmaceuticals, and while they're very expensive, they're not one of the top drivers of healthcare cost. Administrative expenses are how do we comply with complex insurance plans and government payers adds about 30% of cost to that. Lifestyle, smoking, alcohol abuse, diet, and obesity. And guess where those things occur? They occur in populations where there's high poverty, where they don't have access to food. So what's available in high poverty areas? Fast food, because it's cheap, but it has very low nutritional value. So what goes along with that high poverty is chronic disease. 75% of healthcare expenditures are taking care of people with chronic disease. Hypertension, heart disease, diabetes, cancer. And 5% of patients account for 50% of healthcare expenditures. So instead of chasing pharmaceuticals, we should probably look at that 5% and figure out how to take care of them better, most of which was pointed out well by the other panelist here, is primary care. So where you have food deserts, you also have physician deserts. If you look around our community, physicians are in downtown Macon, they're in North Macon. Go to South Macon, go to East Macon. It's hard to find. And then availability of healthcare is not access. So those providers, those services have to be in a place that people can access them. If you're somebody that's making $8 an hour, taking 4 hours of your day to sit in a physician's office where you have to travel, if you don't have transportation, it's not on a bus route. So those are all things that we need to think about. But I think primary care is our solution. We've talked about it now for, 20, 30 years. I'm proud to be part of a healthcare system that believes primary care is the answer, and that our job is to keep people out of the hospital. Piedmont Healthcare has now just short of 1,900 physician practices around the state of Georgia. We're the largest healthcare system in Georgia, and 80% of the population of Georgia is an hour or less away from one of our facilities. So what you'll see, when I was here, I don't know how many, 2 years ago, I was with another entity. We were Coliseum here 50 years. I'm happy that Piedmont's going to continue on, but you're going to see a major investment to access, and primary care will be a major component of that access to care here in Middle Georgia.
It is hard being the last one. I just realized that. I was all like, man, it was easy when I was first. No, actually, really what my colleagues have shared here, but I would say, one of the things that I would mention, and to the audience, to the team here, is that, we're sharing all these insights, we're sharing all this information, and we're like, well, you guys have all the answers. Why haven't you fixed it? Because it's hard. It's hard to fix this. It's hard to address these issues. Just to really summarize everything that was said with the entire team here, when we're talking about inflation, we're talking about the impacts that we're having on our economy. I was listening to the radio this morning, and they said that, your 4th of July cookout is going to cost you $31 more this year than it did 2 years ago. That's how much it's gone up, right? And so when you're looking at, those impacts and what's happening within our society, what's happening within our in our country, it makes it exponentially more challenging. So what we're looking at here is, as Stephen said, it's about access. It's about maximizing our capacity. We don't do that oftentimes. We do have a lot of clinics, but we're not maximizing those capacities. The templates aren't full. Why isn't that? Well, because there's a large no-show rate. Why is there such a large no-show rate? Because they have transportation challenges. There's all these variables that we're trying to navigate and work through. So again, the focus here really goes back to what Stephen mentioned earlier. We do not, and how do we manage and support and control cost? Well, we cannot, and we try not to be everything to everyone. But we should partner with everyone that helps us advance this work, right? So as I say in my native language, unidos somos más. Together we are more. And that's how we're going to make an impact, and how we're going to drive these efforts forward.
Our next question, I want to start with Renee, which is ironic because she's part of the state. And my question has to do with federal and state regulations. So if you could wave your magic wand and change one thing at the federal or state level that regulates your operations, what would you pick and why? And what does the average citizen not understand about how your entity is regulated and how it impacts the delivery of care?
So I did the math really quick when you said you were going to go left to right. And I said, oh, man. That means I'm starting with number 4. So I had to decide exactly how many worms I was going to let out of the can of worms. So I'm going to let out a couple of big ones. And it's a magic wand, so I'm going to go big. So I think it would be a major win if we would stop the practice of persons who are not trained in medicine practicing medicine. And let me explain what I mean by that. So for example, if your clinician thinks that you need a particular test, for example, an MRI, and they write for you to get that MRI, for another entity, and I'll be blatant, an insurance company to require you to jump through multiple hoops before you can get that MRI, technically is them questioning, the authority of the medical provider who saw the need and recommended it. And I think that it's gotten to the point where, for example, prior authorizations are the bane of many a clinician's life, because you're there and you're trying to get services for your client, and you have this third party interfering with the patient care that you can deliver. And so I'll give a personal example. My mom had breast cancer. And so I had a clinician recommend that I get a mammogram. To me, that's easy peasy, okay? And then I have a third party intervening and say, wait a minute, even though you have this script, we're not ready to let you do that. You need to jump through X, Y, and Z if you want us to cover that. And so I think the second part of this question is important in terms of what does the average citizen not understand about that? What they don't understand about it is that that's not how it has to be. That's how it has evolved to be, but that's not how it has to be. And the reason why I'm concerned about it is because, for example, we do, for women who can't afford mammograms, we connect them with that service. But if you have an extra step that you're requiring someone to go through, these cancers, they don't sit and say, she has to do a couple of other steps before she can get this done or that done. So you're basically delaying care at that point in time, which to me, I feel like it's done for economic reasons, and I don't think it's always done with the patient's the goal of the best health for the patient at heart. And so I'll leave that there, because as you mentioned, I'm a state employee, and I think that's the furthest I can go.
I noticed you didn't pick a federal or state regulation.
Yeah, in terms of towing the line. So I went federal, I went big. And I'll leave it there.
All right, Steve, to you.
Well, let me start by saying, I think regulation is put in place to protect all of us. And I think, at least in the beginning, it does that. But like with any governmental agency, once something is passed into law, it's very hard to change it. It is impossible to remove it, almost impossible. And so, as we improve healthcare, those regulations don't follow us, and things that were put in place to protect us now become hindrances, and those regulations add cost to comply with. The number of people we have to comply with them, the audits that we have to hire accountants to do. So it adds cost to the system. If I could wave my magic wand, and I'm gonna try to be general, I would like the regulations that limit access to care to be modernized. One comes to mind in particular, certificate of need. We saw some change in it a couple of years ago here in the state of Georgia. It needs some additional work. I'm not saying to eliminate it, but I think there are parts of it that limit access to care and add unnecessary cost to bringing that access to the market.
Luis?
Interestingly, I believe, as we've seen in all the other questions, we are very much aligned. I will say that where we, if I can have my wish, we would see greater alignment between the payers and the organization. And that is an opportunity that exists at every level, not only with commercials, but also with governmental payers, as we're dealing with some of those challenges. One of the things that we saw during COVID-19, when the pandemic started back in January-ish of 2020, right? 2020?
It just feels like 2000.
It just feels like 2000, but in 2020, it was, although the pandemic brought with it a tremendous amount of challenge and suffering and many different impacts, it also brought some good things. It forced our legislators to look at doing things differently. It forced them to make some adjustments in the form of waivers and other mechanisms to say, we're going to allow you to provide care this way, meaning virtual health, meaning televisits, and we're going to go ahead and reimburse you the same way we normally do. Telehealth isn't new.
Right.
Telehealth has been around forever, but no one can afford to go into it because of the reimbursement models not being aligned. So how do we work to make those changes? And so the pandemic did allow some of those mechanisms to come together. And what have we seen? Great success. The consumer, the patient, loves it. I don't have to leave my house. I can still see my doctor. I'm getting my prescription. I'm getting the care I need. So it's there's all these these vehicles that now have proven to be very successful, but yet, as Steve mentioned, we're getting to that point where the pandemic is starting to, we're moving into that endemic stage of the pandemic. And so some of these mechanisms that were in place temporarily are starting to go back to the way they were. How do we become more nimble, and how do we adjust, and how do we make those necessary changes to capitalize on those wonderful learnings that we had over the last 2 years for the benefit of our patients and our communities? That's what I would wish we could do there.
Is that your wand?
Yeah.
Thank you. Shannon, your turn.
And I get to back cleanup. I'm very excited. I want to just comment on some things before. The number one burden of disease for chronic disease in the world is depression. Okay, that's issue number one. With regard to the federal and state regulation and what would I dream of? Because I'm batting cleanup, I'm going to tell you two. I agree with everything that's been said about alignment and nimbleness and all of that. One of the things that we have to look at as health professional shortage is such an issue, is alignment of the time it takes to train the pipeline to the needs of the market. Think back 15 years ago, 20 years ago, all nurses RNs had to have a 4-year degree. There was a need in the market, and it went to 2 years. It's possible to do that for other disciplines, if we're willing. That would be incredibly helpful for us, I'll speak. And then, as our previous panelists have spoken about, we are audited beyond belief. We have insurers who audit. We are required to be nationally accredited. We are required to meet Medicaid guidelines. And sometimes one auditor says put the scissors in the right drawer, and the other auditor says put the scissors in the left drawer. And so keeping all of that straight takes a staff, which adds costs. And so just simplification and unification would be an incredible help. And then finally, I dream of the day when we're truly able to deliver patient-centered care. I dream of the day. I've been working 30 years, so we'll see if it really happens.
None of you mentioned attorneys. I am so hurt.
We're polite, Julie.
Julia,
I'm on your team here.
Julia, one thing I think it's important for my world that the average citizen doesn't understand is that the legal guidelines for involuntary care, and particularly involuntary administration of medication, are incredibly narrow. And so it absolutely breaks my heart. And I understand from a civil liberties perspective, our pendulum used to be, I want to divorce my wife, so send her to Central State. Okay, I mean, really, that really happened. Okay, and so the advocate community said, no, we need our rights. And so the pendulum swung this way. But what happens in our world today, because the pendulum is over here, if a person presents delirious with fever in the emergency room, a physician can administer medications to address that fever and bring them to their right mind. If they present delusional and psychotic, they cannot, without going through all these hoops, administer the same medication to bring them to their right mind. And that is heartbreaking for families, and they don't understand. I dream of the day that we can humanely address a broken brain.
Thank you. All right, all of you have hit on this healthcare worker shortage that we have. We had it even before COVID-19 hit, and that has just amplified it. In practice, these shortages can contribute to decreased quality of care. So how is your organization managing this issue, and how can we help you as the chamber? Because we're pretty good, right? Who's first? Steve, we're back to you, right?
Well, just before I came, I was reviewing wage increases that we have implemented already this year. 14%, our salary and wages have gone up 14% in 6 months. That's an incredible inflation of wages, but that's what it takes to attract people. You know, the one thing I learned when I came to Macon is that no one comes here for vacation. But if you can get them here, it's a pretty good place to live. So we don't have much in-migration to this market. We have a lot of out-migration. We lose people to Atlanta primarily. So our focus has been to partner with the local schools, Middle Georgia State University, Central Georgia Tech, Gordon College, say, how do we keep those students here? And that is getting them our hospitals and making sure they have a good experience and supporting their development as a professional and having a way for them to advance their career without having to leave Macon. So I'm not sure that that is, terribly new, but we're in a really competitive labor market. Healthcare is hard. I jokingly say in orientation that it takes a special person to come to work every day knowing you're going to be pooped on, peed on, or puked on. And while I say that jestfully, think about that for a minute. The people that we're looking for have to see through that and see the person that is vulnerable and needs our care. And so finding those people are hard.
Let me throw something in for you to add, and all the panelists can do this. For those who are already employed with you, though, that are burned out, what are you doing to help them?
So, this kind of goes, I think we got as much out of COVID-19 as we suffered from it. And part of that was recognizing that even before COVID, our staff were under a tremendous amount of stress due to staffing levels, due to the types of patients that they're dealing with, family members. Healthcare has become a very hostile environment. And a lot of our staff get injured every day. And so we had to really look at how are we meeting that need and making sure that people get the breaks they need. And say, oh, I didn't go to lunch. We now mandate a lunch break. We don't care if you eat, but you need time to step away from that emotionally, physically demanding environment to take a breath. It'll be better for our staff and it's better for patient care. And then we had to have some ways for them to access care anonymously. I'm sure, as my colleague here knows, mental health still carries a stigma with it, and people don't want to admit that they need help. So we provided places that they could go and places they could call to talk about the issues that they're having. But it's a difficult environment right now, but there are also people that want to serve, and our job is to find them out there and help them find their calling.
Wow, it's so staffing. I don't think a day goes by when we don't talk about staffing. It's become the daily challenge in every one of our organizations. And when I say every one of our organizations, I'm just even speaking to our community as a whole. When you look at it, you ask, what can the Macon Chamber, Greater Chamber do to help? Well, they do what they do best, and that's they market our community to make sure that it is a wonderful place for work, to play and to live, right? I mean, that's what we want to make sure we do. But when we're looking at it, I mean, we have never been in a position, or at least not in my short lifetime, it was across the board. Everyone was looking for help. I don't think you can go to any employer in this entire region that's not looking for help or hiring at the moment. And so how do we navigate that? How do we manage that? And so I'm glad you brought up that point in that question, because it comes down to, it's not just about how do we look at staffing up and making sure we get the resources we need to support the care delivery and the work that's ahead of us, but how do we retain what we have? And I think we put just as much energy on the retaining, probably more so in the retaining than we do in the hiring. Hiring, we're just working through the process. Retaining, we want to make sure that we're addressing all of the key elements of our staff's lives. How do we support them best? We call it internally, we have this thing, how do we address and how do we provide them with, with that love factor, right? We love our staff. We're so thankful for our staff. And how do we make things, and how do we put mechanisms, benefits, and other structures in place to ensure that they feel that love, that they feel that support, and that they stay. Others, I would hope that they hear that and would want to be part of an environment like that. And that will help with the hiring process. So again, it's one of those things where we're partnering with again all the educational institutions, with our technical schools, with creating pipelines, developing scholarship mechanisms, developing grant mechanisms, developing just various vehicles by which we can help support not only again the community and those institutions themselves, but also creating that pipeline for the future workforce, which is going to look very different as we continue on this journey. So.
Thank you. Shannon?
For recruitment, we're in a full court press to recruit. To retain, we're giving great attention to our culture right now at River Edge. And in addition to the EAP, Employee Assistance Program services that have been in place for a very long time, we're doing things during the workday to help reduce the stress. For example, today at 2 o'clock, we had yoga on site during the work hour because people need an opportunity to de-stress. We're going to be rolling out mindfulness minutes, just opportunities to do progressive relaxation, and because what the research says that it improves concentration and stress levels and that sort of thing. And then what can the chamber do to be helpful? You can help us by advocating with the university systems around building the workforce pipeline, especially around nursing, licensed practical nursing, and particularly the counseling disciplines for my world, and to work to reduce the cycle time of training. Just so you know, in order to be a licensed therapist in Georgia, you have to have 4 years plus 2 years plus 3 years before you're fully licensed. That's a long time. Okay, and then secondly, even today, many of our training programs train people to work in private practice. That's kind of how the tenor of the training program. We really need attention to working in group practices and agency-based organizations, as well as not giving so much attention to theory, but to the evidence-based treatment technologies that are known to be effective today. So those things would be really helpful.
So similar to what was mentioned in terms of activities for mindfulness and physical activity, we have a worksite wellness group that coordinates that throughout all 13 counties and encourages them to be active. Our most recent challenge this weekend was to take a picture of yourself doing something healthy and submit it over the weekend for a chance to win several gift cards. So we do that in addition to, we also had it where our EAP, which is our Employee Assistance Program, came and did a presentation about burnout, how to prevent it, and how to create a safe working environment for yourself. This was particularly important for us because our employees were out in the elements doing COVID-19 testing and vaccinating. So they kind of had a rough time of it. So we had to do logistics in terms of making sure that they weren't there every holiday, that we rotated the holidays throughout the district. So we tried to tackle it from both sides, which is we tried to prevent it from occurring, and when it did occur, we tried to make sure that they were aware of the resources that they were entitled to as employees. I'll go ahead and talk about retaining, because if we can get them to stay, it tends to be a better fit for us because they're already trained. And so it's very hard for us as public health usually to compete with salary. That's, we have limited funds because the population we serve, we provide those services whether or not they can afford to pay for them. Our mission is to give you the service if we have it available. Whether or not you can pay, that's inconsequential. And so one of the things that I will say I was very proud of our legislature was that they did do the cost of living adjustment, which gave us the $5,000 to every full-time employee. And so that helped quite a bit. But the other thing that we did was that we realized when we had we're chronically short-staffed and we're trying to address that, but what we realized is when we had an employee assisting with the roles and responsibilities of another employee, that we should compensate them and we should be aggressive about it. And so we empowered their supervisors to give them a 15% supplement if they knew an employee was going out, as soon so that the employee didn't kind of feel unappreciated, which is now this person left, now it's just more work for me. So we tried to get that culture shift, which is yes, this person is doing extra responsibilities, you can talk about compensation. Say, can you help us with this while so-and-so is out? We'd be able to do this for you until we can get a replacement. So one of that was trying to compensate them for our areas where we were short-staffed. The other thing is recognition. A lot of times, folks might leave an organization because they feel they're not appreciated. They don't feel folks are recognizing their blood, sweat, and tears that they're bringing to the organization. And so we encourage recognition. We have an Employee of the Quarter program where you can nominate in about 10 different categories. And then we also do it where we let everyone know who is the recipient of that recognition. So those are the strategies that we're doing. The Chamber has helped us out a bit already. There was a video series explaining our environmental health and what they do, and so that's targeted to high school students so that hopefully we can get them earlier in the pipeline. And so I think if the Chamber can continue to, think of public health when you have opportunities to let the community know what public health does, it is very beneficial to us, and we are grateful for that previous opportunity, and hopefully there'll be more.
Julie, let me just add a couple other thoughts here. I think I'm probably the oldest guy up here. And, I've been around long enough to see the pendulum swing in favor of employer and in favor of the staff. And one thing I've learned is that we have to think about retention differently. I was sharing with Louise earlier, I worked for HCA Healthcare for 32 years, and some of my friends looked at me and said, well, you couldn't get another job? But my kids, who are 29 years old, staying someplace to them 2 years is a long time. So we have to think about retention in a little different way. And maybe I don't retain them here in Macon, but maybe I retain them at Piedmont, Atlanta, and we move people around. We all suffered from travel contracts, both what we're paying and for people that left us. So we came up with an internal travel agency, our own, so they can still have that feeling of not being in one place all the time, because there are people that like to move around, but they're moving around within our health system. So the 13 weeks in Macon, and the 13 weeks in Cartersville, 13 weeks in Augusta. And then if they really find some place in the system that they have a real sense of belonging, then maybe they change to full-time there. But, we're kind of reverting back. There's new names put on them, but we're going back to schedules with more flexibility. Summers off, weekend option, Baylor plans, things that give employees a little bit more flexibility in their work schedule to match it with their life, because for the baby boomers, work was our life. For my kids, work is a means to other things. And so it's good to have some youth on your executive team and in your organization too to help
Right,
us
Boomer.
connect with those younger people.
I said, all right, Boomer, we'll close it with that. Well, that brings us to the top of the hour. Kathy, is that right, at 5? Okay, well, I want to thank all of our panelists. Will you please join me? I'm going to call Dr. Allen, or it's Ron Shipman, our illustrious leader, interim CEO and president of the Greater Macon Chamber of Commerce. Thank you.
Thank you, Julia. To all of the panelists, so if you think about batting cleanup, think about closing. So here I am. So most of you know me. I'm Ron Shipman. I'm the interim president and CEO of the Greater Macon Chamber of Commerce, and this is not going to be long. So a number of things. One, panelists, thank you so very much for participating, for offering insight to your world, because it's a different world most of us don't see until we actually need you. So thank you for offering that insight. Thank you to the guests for being here to listen and to be informed from the leaders of the organization. That's one of the things that we pride ourselves at the Chamber about this particular forum. We have leaders of the organizations to sit and talk and answer questions and tell you what they're doing, not only to help Middle Georgia, but to help the healthcare system in general. So we just simply want to say thank you. Board members, we have several board members in the audience. I want to say thank you. Thank you for being here. Thank you for supporting the chamber as well. And Julia, I like you. Past chair is the best role you can ever possibly have. And lastly, I want to thank the sponsors, the presenting sponsor, Atrium Health Navicent, but also Houston Clinic, Internal Medicine Associates, Central Georgia Cancer Care, and Skin Care Physicians of Georgia. We could not do this program without your support of the chamber and your support of this type of a venue. So thank you for that. I'm going to close on basically two things. And Dr. Hayes, this morning I had a panel discussion, or Julia moderated another panel discussion with one of your colleagues, and he said something to me I want to bring forth to this group. And I'm going to paraphrase it a little bit, and it'll kind of give you an idea where the chamber's mind, at least where my mind is with healthcare. A business would find it difficult to be successful in a sick community. That resonated with me like you could never possibly imagine. Think about that. In order for the community to be, in order for the business to be successful, the community must be healthy. And so thank you for doing what you do. And one final thing I will say, in my world prior to, Steve, I got you a little bit. I'm 36 years retired 2 years ago, so I got it. I'm a boomer too, so I understand.
Coming for you, right?
Okay, hey buddy, come on. But this is, in my previous world, this is the way we thought about things. If an individual gets behind on one of these three things, they are going to suffer. One, the cost around housing and transportation, the cost around food and utilities, or the cost around medical care. If one of those three things see an inflationary type bubble in their world, they begin to struggle in all three. So thank you for what you do. Please continue. The chamber will support you. We will do all we can to get as many employees geared in your direction.
Thank you.
Because we need them too. So let's give them all a hand. And so next on the agenda is a reception, and then we'll have the residents come forth later on. So come join us, and let's talk to the panelists. Thank you, panelists, again.
See you.